as you often hear, a budget is about priorities. And I think when you review our budget, you will see the priorities of the House Republican caucus reflected quite well. The very first thing I would like to talk about is high level in our spending caps. This budget is under all of the caps. We do not break any of them. In the first year, we are under the spending cap by over $44 million. And in the second year, we are under the spending cap by $858 million. It protects all the fiscal guardrails, keeps the volatility cap the way it currently is. And on the revenue side, we are not spending all the dollars that are available. We are under the revenue by $10 million in year one and $177 million in year two. One of the things that we heard most about in the last year definitely has been about the electricity rates for the residents of the state of Connecticut. We have fought tirelessly up here to try to get review of those public benefit fees, and we have often said that we can afford to put some of them into the state budget. Our budget does just that. We are going to be reducing the public benefit fee by about 25% and putting that amount into the general budget and a small piece into bonding for the EV chargers. We're providing tax relief to our towns through committing to fund the excess cost grant at the tiered levels and continuing on the hold harmless practice, which makes it so towns do not receive less ECS, or education cost sharing funding, than they did in prior years. This is imperative because this is a direct hit to property taxes, where people are feeling a lot of pressure right now, and budgets at the local level are expanding because they cannot rely on the money that they're being promised from the state of Connecticut. We are fulfilling that promise and keeping those dollars in. We're looking at healthcare costs in multiple different pieces here. First of all, we have reviewed the Medicaid study that was done, and we are actually funding $137 million of the $150 million that is required to increase the rates for Medicaid. On top of that, we are expanding the Katie Becker waiver so we can take more people off the waiting list to help these sick individuals and getting them the care that they need. We're also doing something that both the governor's office and the Appropriations Committee didn't do, and that is we're actually funding our contractual obligation for state employee and retiree health care costs. Both of the budgets that have been presented prior to ours are very dangerous in the fact that they know that these expenses are climbing and are going to be higher, and they have chosen to not fund them, to say that we hope we'll be able to find savings to do that. But if we don't find the savings, we're just going to take it from the OPEB savings account. This is a practice that's gotten Connecticut in trouble in the past, when we are not actually budgeting for expenses that we know and hoping that we have savings to cover it. It's dangerous. I don't know anybody in the real world who does something like that. We're also removing $13 million directly from health insurance premiums. The Malloy administration, when the times were tough with budgets, they took about $4.5 million in programs and they shifted it to an assessment on people who have insurance. That $4.5 million has ballooned to over $12 million because it's in an off budget, it's in the insurance fund, nobody's really being held accountable to that. We're moving those expenses back onto the general fund, which will be a direct reduction in health care premium. Other things that we're doing is we're providing critical funding for cold weather shelters to protect homeless individuals in the winter. As you know, we've seen an increase in homelessness in the state of Connecticut, and we're committing to making sure we've got facilities for that. We are increasing funding for domestic violence outreach in a couple of different places in this budget. And we're also increasing the funding for nonprofit providers, exceeding the governor's proposal at 3% a year. So you might be wondering how we managed to do all of this and still stay under the caps when that is not something that has been achieved by the other side. Well, we put in a lot of hours to find taxpayer savings. We reviewed the last 3 years of actual spend. We looked for opportunities where there were lapses and deficiencies, and we've made all those corrections. We're cutting healthcare costs for illegal immigrants. At this time, it is projected that it's going to be about $116 million over the biennium for illegal immigrant health care costs. But we are keeping in place the emergency Medicaid. So if somebody, regardless of their status, needs emergency care, they can get emergency Medicaid. Instead, we're taking that money and we're funding Medicaid rate increases. Instead of giving $386 million more to the higher education units, bringing them over $1 billion of tax subsidized payments for adult learners, We're giving them a modest increase of 8%, which is a higher increase than a lot of the other budget lines are getting. And we're taking that $386 million, and instead we're giving you $430 million of public benefit fee relief. Sorry. Our plan imposes a 2-year wage freeze on state employees. The last few years, state employees have gotten a 33% increase in one-time pensionable bonuses. We're saving $330 million over the 2 years by doing that. And what's good for the goose is definitely good for the gander. We're also removing automatic pay increases for legislators and all of the elected bodies, which is going to save us nearly another $1 million. We're reducing operating expenses overall throughout the state agencies by 5%, resulting in a 2-year savings of $67 million of their other expense line. Most importantly, we're continuing to listen to the state of Connecticut residents who showed up en masse in 1992, where 82% of the people who showed up to vote said, "We want you. You cannot spend more money than we make." They asked us to change our Constitution to establish a spending limit. It's the highest amount of votes ever put on any question. No elected official has even come close to that vote. Currently, Governor Lamont got 657,000 votes. 830,000 people showed up and said, "We want you to not spend more money than we make." And that is what established the spending cap. We are listening to them. We're staying within those limits because we respect the voices of the voters, and we agree that government has to live within its means.